Section 7. Complementary and alternative medicines. And I think this part would be very interesting. So far, all of the process of the drug discovery and drug development process, such as clinical trial, application to regulatory bodies, are known as modern medicine. And in this section, I want to talk about other potential treatments that we consider complementary and alternative medicines. So, what is an alternative medicine? Alternative medicine, by definition, describes any practice that aims to achieve the healing effect of medicine, but which lacks biological plausibility and is untested, untestable, or proven ineffective. Complementary medicine, abbreviated CM, complementary and alternative medicine, abbreviated CAM, integrated medicine and integrative medicine, IM, and holistic medicine are among the many rebranding of the same phenomenon. So if you hear any of these are all talking about the same thing. Essentially, they are medicine that either don't follow the scientific process, they're not biologically possible, they didn't test it, they cannot test this, or simply ineffective. All the practices that we have discussed so far, whether it is the clinical trial, the applications, the regulatory bodies, this is what we call medical or modern science. Any alternative practices based on theories that contradict the science or of how human body works are what we classify as pseudoscience or supernatural or superstition. And how do we differentiate this? We differentiate, for example, for medical science, we require strong evidence using the scientific method and approach. This is, for example, coming up with a hypothesis, testing your hypothesis, and designing your experiment properly and see the result using statistics or mathematical models. Whereas pseudoscience will contain partial or false evidence without the scientific approach. And lastly, for supernatural and superstition, there are no evidence, no basis, or any approach. You believe it or take it as it is, whether through stories, or anecdotal evidence, or tradition. Alternative medicine fall under either pseudoscience or supernatural superstition category. Research into alternative therapies often fail to follow proper research protocol, such as placebo-controlled trials, blind experiments, and calculation of prior probability, providing invalid results. Much of the perceived effect of an alternative practice arises from the belief that it will be effective, known as placebo, or from the treatment condition resolving on its own, the natural course of disease. Now, I'm not saying that all alternative medicines are bad, but we have to understand that there's not enough scientific approach to obtain evidence to show that what they're doing exactly works. Also, there's a potential of more side effects compared to the benefits. And the side effects is not just directly seeing a new symptom or a new problem, but also the lack of treatment itself can bring side effects, or the disease itself can bring side effects because you're not treating it. And this is something we don't want, because in modern medicine, the first thing we want to do is to do no harm. And actually, the lack of treatment or the falsification of a therapeutic effect is harmful. And so it's something we need to consider. And also, experts are on your side. Any of the healthcare, such as pharmacists, doctors, nurses, pharmaceutical scientists, research scientists, or any of those people in the field, you can consult them, ask questions, and they'll be more than happy to tell you what is right and what is wrong. And know that sometimes there are better options out there in modern medicine. It's done through proper research. It takes about 18 years to make sure that it is effective, less side effect, and all the way until it's marketed for the public to use, as we have discussed. It is important to follow logic and the scientific process and understand what is best for you to make you feel better. And one thing to note is some alternative medicines do work or has some level of scientific methods that follow with it. But it depends on what you are treating. For example, in the absence of the bias of the placebo effect or the body's immune system to treat the disease naturally, for diseases that are not expected to get better by themselves, such as cancer or HIV infection, multiple studies have shown significantly worse outcomes if the patients turn to alternative therapies. And while this may be because these patients avoid effective treatments, some alternative therapies are actually harmful. For example, some people use cyanide as alternative medicine or intentional ingestion of hydrogen peroxide. And these are actually harmful. They are toxic to your human body. Whether you have sickness or not, even when you're healthy, these are toxic to you. The alternative sector is actually a highly profitable industry with a strong lobby and faces far less regulation over the use and marketing of unproven treatments. Its marketing often advertises the treatment as being quote-unquote natural or quote-unquote holistic. in comparison to those offered by quote-unquote big pharma. And so this is a problem. We talked about big pharma and all the lawsuits that they had. Yes, there are problems, but they are found out by regulations on the problems or the mistakes that they have done, or their intentional harm for other people. For alternative medicine, the regulatory bodies and the regulations and standards are so lacking that they can get away with it. And so it is a risk by nature to take alternative medicines. Billions of dollars have been spent studying alternative medicine with little to no positive results, and that is simply the fact. Some of the most successful practices are only considered alternative under a very specific definition, and we will talk about each of them in more detail.